Assalamu alaikum students, welcome to lecture 10 and I'm your course instructor Dr. Shabnam Nazir. The topic is Protocol of Bioavailability Studies. Okay, so the outline for today's lecture is first of all, this lecture is composed of two parts, part 1 and part 2. In this lecture, obviously, we are going to discuss part 1, and in that, we will be discussing the objectives for setting protocol of bioavailability studies, and then along with that, we will be discussing the study design, which is part of protocol. Other parts of the protocol we will be discussing in the next lecture. So, before proceeding to protocol of bioavailability studies, I want to mention about bioequivalence, just to see how both these terms are interrelated. So, two dosage forms will be considered bioequivalent if drug substances in the identical dosage form reaches the systemic circulation at the same relative rate and extent. So actually various similar dosage forms with similar drug of course are being evaluated for their bioavailability, whether any significant difference is out there or not. So such a study is called bioequivalence study, and as bioavailability studies is being measured, so same protocol will be applicable to both kind of studies. Previously, we discussed objectives of bioavailability studies. Almost same objectives are associated with bioequivalence studies as well. It is used for studying various variables of the formulation during developmental process, and the same information is required to proceed with regulatory procedures. Similarly, bioequivalence studies are also used to establish pharmacokinetic parameters. Okay, bioavailability studies or bioequivalence studies, whatever you're gonna perform, those could be single dose studies or multiple dose studies. Now, in case of single dose study, it could be declared as that type of study in which bioavailability is determined after administration of a single dose. Now, these are most commonly adopted version of single dose studies, and these are usually adopted because these take lesser time to be conducted. Moreover, these are safer as compared to multiple dose studies in case of various other drugs like antipsychotic drugs or antidepressant drugs or various other kind of drugs are there which are not that safe. So that's why their multiple dose studies are also not that safe. So, in those situations, multiple dose studies are often avoided, but obviously, that is not the solution because the single dose study is associated with a biggest disadvantage, and that is that you can never know or predict the steady state drug concentration. And the reason is that you never attain the steady state levels because you are administering the single dose, not multiple doses. Remember that steady state is achieved only after multiple number of doses. Multiple dose study is a type of study in which the bioavailability is determined after multiple doses. Now it is very accurate. Definitely it is accurate because it is being conducted after administration of multiple number of doses. Every dose is associated with sampling and those samples are being analyzed. Concentrations are being obtained for every dose. And at the end, the mean value for the concentrations which are being obtained are more reliable as compared to the single dose study. So, the second most important thing associated with multiple dose study is that as there are multiple number of doses and the mean values are more reliable, the intersubject variability would be eliminated as well. Better evaluation of controlled release formulations, as we can include the controlled release formulation very easily in the category of multiple doses. formulations, because controlled release formulation is releasing a drug at a sustained rate for a prolonged period of time. So those kind of formulations, whenever they are being assessed or evaluated for their bioavailability studies, they are usually categorized as multiple dose studies. Then the onset of nonlinear kinetics can be detected very easily with the help of multiple dose studies. As we know that in case of multiple dose studies, multiple dose regimen is usually controlled by two important parameters. One is the dose size and the other is the frequency. So let's suppose the next dose is being administered before the complete elimination of the previous dose. What will happen that there would be drug accumulation in the body, and that leads to increase in the level of the drug within the body with every upcoming dose. So for example, the dose size has not been controlled in a proper way, has not been calculated in a proper way. A time would reach, because of drug accumulation, that saturation of the transporters and enzyme would take place, and the situation would lead to nonlinear kinetics. So that when that stage would be reached, that can be detected in case of multiple dose studies. Along with the advantages, there are many disadvantages associated with multiple dose studies. The first risk is that subject compliance is at risk. Definitely, these studies are prolonged studies, as these are multiple dose studies, and these are continued till the steady state level is achieved. So, subject compliance is usually at risk. The subjects could leave the study at any given time point. It is a time consuming process because of definitely the multiple number of doses being administered rather than a single dose. And the third very important disadvantage of this study is that it is not a good idea to be conducted for drugs which are not quite safe, as the patients or the volunteers are exposed to the drug multiple number of times till the steady state level is achieved. So, especially the drugs which are having certain safety issues, if they are being studied through multiple dose study, special precautions or care need to be taken. Otherwise, patient or the volunteer safety is at risk because of the more exposure to the drug. Now, coming to the study design or the pattern, bioequivalence studies can be conducted in two possible ways. The first way is called parallel study design, while the second one is called crossover study design. Now, depending upon the number of the formulations which are being compared for their bioequivalence, there are possible ways for conducting the crossover study. It could be two-way crossover study, or it could be three-way crossover study, or more than that, depending upon the number of formulations being compared for their bioequivalence. What happens in case of parallel study design, that a group of volunteers or the patients are randomly divided into two groups. Now, the formulations in question are two in number, and the formulations are now administered randomly to those two groups of volunteers. Now, the biggest disadvantage associated with this kind of study is, though it is taking lesser time, but the problem is that inter-subject variability is not considered at all in this kind of study. While we know that the inter-subject variability exists, and the idea behind the inter-subject variability is that The subjects vary from each other because of the genetic reasons, or the age, gender, or biochemical factors play a very important role. Some very important differences might exist in the individuals, and the drug response might vary from individual to individual. The pharmacokinetics of the drug will vary from one individual to the other individual, depending upon the inter-subject variability, whatever they hold. So that idea has not been considered in this kind of study, and this is the biggest disadvantage of this study. In case of crossover study, study subjects are divided into two groups. And for example, there are two formulations, formulation A and B. So one group would be administered with formulation A, while the other one or the second group would be administered with formulation B in one segment of the study. Same subject administered with formulation A in one study will be administered with formulation B in next segment of the study. So what is happening that each formulation is being administered only once in each study period, and more the number of formulations, greater will be the number of the segments of the study. So study period will be more than one. Let's suppose there are two formulations, so definitely the study will take place in two segments. If there are three formulations, study period will be completed in three segments, and so on. Now here on the slide, you can see that there are 14 number of subjects which have been divided into two groups. So each group is carrying equal number of subjects. So what is happening that there are two formulations, and the group 1 is being administered with formulation A in first schedule of the study, and the second group is being administered with formulation B in first schedule of the study, or you can say in first segment of the study. While in the second schedule or segment of the study, this group A, the first group is being administered with the formulation B. Now this formulation was administered in the previous segment or schedule of the study to group 2, but now the positions are exchanged. So that is the reason mainly that this kind of crossover study is called two-way crossover study, and the main reason that why these studies are called crossover study, you can see that the formulations are crossing over each other in two segments or two schedules of the study. The criteria is applicable when the formulations number will exceed than 2. For example, if there are 3 formulations, then those will be happening in 3 segments. And similarly, the positions of the drugs would be exchanged in each segment. Advantages of crossover study: lesser number of subjects can give substantial results. As we have seen in the previous example of two-way crossover study design, that there were 14 number of subjects and they were divided into two groups. Each group was containing 7 number of subjects, and the formulation A and B was being administered to them, to both of the groups, in two segments of the study in a crossover way. So, despite the fact that the number of subjects was lesser, the results which you are getting are substantial, and in this way, when the same formulation is being administered to both of the groups, inter-subject variability also gets eliminated. Another advantage of crossover study is that there is a suitable washover period involved, which eliminates the carryover effect. Washover period means, or washout period means, that between two segments or schedule of the study there is a suitable gap or time period involved, which helps to eliminate the carryover effect. Now what is carryover effect? Carryover effect means that the presence of the trace amount of the drugs from the previous administration, and ideally traces of the drugs from the previous administration should not interfere with the next administration or with the results of the next study or upcoming study. So that thing is eliminated with the help of a suitable washout period in between, And between those days, the drug is previous drug traces are completely eliminated from the body, so it won't be interfering with the upcoming dose of the drug. Disadvantages of crossover study. So if there are advantages associated with the crossover study, there are few disadvantages as well. And the main reason is the longer time period involved in case of crossover studies, as these studies get completed in various steps. In addition to that, if greater number of formulations are involved, definitely greater steps would get involved and longer time periods will be invested. Meanwhile, the subjects might lose the interest and they may leave the study halfway because of longer periods involved. So, these are the main disadvantages which are associated with the crossover studies, and these should be considered whenever the crossover studies are being designed. These factors should be kept in mind. Okay, students, the topic is still continued, and in upcoming lecture, we will be touching other parts of the protocol of the bioavailability studies.